Everybody.
Good evening.
Thank you all for joining Birth in Color this evening. For this webinar, we want to honor Sickle Cell Awareness Month, featuring those who have been either diagnosed with sickle cell, those who are sickle cell advocates, or those who have a family member that has sickle cell. Birth in Color is a reproductive justice organization that specializes in policy, maternal health, and a large fatherhood initiative. Please introduce yourselves and share anything you would like the audience to know about yourself or your journey. And so we'll start with Delegate King.
Hi, thank you so much, Kenda, and thank you to Birth in Color and everyone who is out fighting for health equity. I'm Delegate Candy Munden King. I represent Prince William and Stafford counties in the Virginia House of Delegates, and I'm also one of the founders of the Sickle Cell Caucus in the Virginia General Assembly.
Thank you so much for that. And now you, Miss Mary.
Good evening, everyone. I'm Mary Coleman. I'm Emerging Markets Account Manager for the American Red Cross. I'm based in Richmond, but I travel the state of Virginia doing sickle cell education and encouraging Black people to donate blood to help meet the needs of sickle cell patients. I've also given birth 8 times, and I have 6 daughters, so maternal health means a lot to me, and a daughter-in-law. And I have 10 grandchildren, and 7 of them are female. So I'm going to be in the business of caring about maternal health for a long, long time.
Wow, that's a lot of births right there. How do you manage with all of that?
That's another webinar. We'll have that webinar another day.
Okay.
Yes, I have questions.
I was say, especially when you start to have daughters and your daughters act like you, and you just be like, okay, all right. So this is what we're dealing with. And so I will send to the stage by asking you both, and whoever wants to answer the question first, what is sickle cell disease and how does it specifically affect the body from your knowledge?
Yeah, and I think because the Red Cross has been like on the front lines of sickle cell for so long, Ms. Mary can give a more technical answer, but I will just say that sickle cell disorders is a group of disorders. It's an inherited blood disorder that was discovered officially about the early 1900s. And basically, instead of round, your blood cells sickle, and they sometimes get trapped in different body parts where blood donations and transfusions can be life-saving and life-altering, because that trapping causes immense pain that has been women who I know who have sickle cell disorders who've given birth have said that a crisis is almost twice the pain of the labor pains. It is an extremely painful disorder. It is extremely misunderstood, and it has been extremely ignored. And so that is sickle cell disorder. One of the things that I'm also passionate about is those who have sickle cell trait, like myself, who may not be aware that this is a genetic condition that they can pass down to their children.
Yeah, thank you for that. And I want to be clear, I'm not a medical professional. I don't have a medical background, and the things that I've learned through my training at the Red Cross. But what I hope that it conveys is that if I can learn it, anybody can learn it. We can all become advocates and have a baseline of knowledge about sickle cell disease. What I'll add to what Delegate King said is that 100,000 people in America are afflicted with this. About 90% of them are Black. And this is a genetic condition. People are born with it. They can't catch it. And the sickling of the cells, as Candy said, causes extreme pain, a lack of oxygen reaching the limbs and the vital organs, that can cause stroke and organ damage and a lower quality of life and a lower life expectancy.
Thank you both so much for those detailed answers. And we try to give as much education as it relates to sickle cell as possible when it comes to just pregnancy in general. I'm just making sure that, hey, you need to find out if you are carriers of trait, what can we actually do? How can we get youth to be more informative about sickle cell also, because recently, a couple of deaths across the US that happened, at a football game or football practice or any type of exercise practice, people their body went into a heart attack. But it was this actual because they had the sickle cell and they were unaware of it. And so, do y'all know anything as it relates to that? I know that upon reading research, it was still something that everyone is trying to like grasp and try to figure out how to fuel that information to where people are actually surveyed.
Yeah. So I'm sorry, Mary.
No, you go ahead.
So I was going to say those deaths that you mentioned are typically related to sickle cell trait, because here's what happened. So I was born in 1982. I'll go ahead and tell y'all too much information, but I was born in 1982, and I was probably one of those last that were not just like everyone was tested in the newborn testing, but now every child is tested. And you're told when your child has sickle cell trait, you're told, oh, they have trait, and there are no symptoms, they'll live a great life. Just make sure if they get married or start a family that they, check and see if the other person has a trait. It's fine. It's fine. Everything is fine. But what we've learned is that these very rare situations with certain conditions where the trait can cause disorder-like situations that can lead to sudden death. And you see that in football, but it is also the number one, I believe it's number 1 or 2 cause of death in boot camps for the military. Because certain altitudes, certain physiological conditions, and that can morph. And there hasn't really been enough research to see the how and the why. But what we're doing in Virginia is that we passed a law that would require, in the same way that we do with people from certain ethnic backgrounds that have higher level of cervical cancer, you go to the doctor and they ask you, do you have this background? And you say yes, and they say, well, we suggest that you get BRCA testing or an additional testing to see because people from your background have this. What we're saying is that doctors need to offer that to patients at their first adult physical exam, because between being told that your baby has sickle cell and 18 years later, as Ms. Mary can probably attest, you're not saying to your child, remember you got sickle cell trait, you got sickle cell, and somehow it may get lost along the way, especially if you don't have a family member who has a sickle cell disorder or just a general awareness of it. But as a legislature, we are extremely concerned about the lack of training for athletic coaches and others around sickle cell trait. Now, sickle cell disorders, there's been a large amount of training and awareness for people with a disorder, but the trait has been less so.
Yeah, and I think what you're describing is the fact that there's a spectrum of sickle cell conditions, right? And there's not a single set of symptoms that apply across all people who have the disease, nor is there a single set of symptoms or reaction for people who have the trait. So the reason why these conversations are so important is because we all have to take ownership of our own diagnoses and get those questions answered. And just for context, 4.4 million people in the world have sickle cell disease. 43 million people have the trait. And so all those people are going to get married. They may or may not have symptoms. I have the trait. I don't have any symptoms. But that may not be the case for everyone. We lost our host.
I think, did you just make me the host?
It wasn't me. Oh. And it probably wasn't intentional. We can move on to the next question.
We can move on to the next question. We'll tell Kendra that we kept it going.
Yes.
And so while I pull up that next question, I just wanted to talk about the Red Cross a little bit, because the Red Cross has really been one of the most consistent advocacy voices for sickle cell. And I remember in the 90s, you know, we had, you know, you had the postage stamp and you had some level of awareness. But could you speak a little about the Red Cross's longstanding commitment to sickle cell awareness and advocacy?
Yeah, so, historically, the Red Cross has been a fairly trusted entity within the Black community. I mean, going way back to, Frederick Douglass and Mary McLeod Bethune, and Charles Drew being the father of blood banking, right? And so there has always been a strong relationship with the Black community, with the Red Cross, and desire to sustain that, while also acknowledging that the medical community at large has not been good to Black people, right? And so the Sickle Cell Initiative, which is more recent, is designed to educate first and foremost the Black community about the disease, not just the fact of it. I mean, I go to audiences all the time. Everybody's heard of sickle cell disease, but they don't know the impacts, which is why a session like this is so important. So we talk about those impacts, but then I also talk about how the science is showing that people of African ancestry are more likely to have blood compatible for the transfusion needs of sickle cell patients. And so we are trying to encourage more Black people to donate and more Black organizations to host blood drives.
Yes, and I'll add, and Kenda's internet is a little spotty, but so she may go in and out. But I'll also add that I think it's so important for people to know that you cannot outgrow sickle cell. You know, I hear other generations and even people in my family saying, "Oh, so and so had sickle cell, but they outgrew it," right? But
Right.
the person who we in the family may have said outgrew it they have stroke complications at early ages. They have other complications. I have a family member who every winter, you know, she is hospitalized for some sort of acute chest syndrome, which is a common complication for sickle cell. And she's a little older and she says, "Oh, I'm just getting older," or no, these are complications of sickle cell. And we're so fortunate to have this great technology and emerging medicine, but there is not a universal or easy cure for sickle cell, which makes the work that you do that much more important. And so I've been very fortunate that my daughter has not needed blood transfusions to this point. But for those who do, I can't underscore how extremely difficult it can be sometimes, the resources in certain communities, especially for Black women. So wanted to talk a little about the sort of unique struggles of Black women with sickle cell, especially in maternal health care. Are there any sort of ways that you've seen a unique struggle with Black women suffering with sickle cell?
The conversations that I've been in with sickle cell patients have not addressed maternal health specifically, but they do dip into bias in the medical community against people of color. And so this goes across the line of what we're familiar with women in labor and their pain not being taken seriously.
Mm-hmm.
So sickle cell patients who are adults, children less so, but who are adults, they'll go to the emergency room, they're in a sickle cell crisis. And what that means is their body is not, the oxygen is not reaching their body, their limbs, they're in this extreme pain. And the medical community will not believe that their pain is as serious as they say it is. Sometimes they have to wait for the medication because the emergency room personnel think that they're drug addicts seeking narcotics, right? And so in some ways, what sickle cell patients experience is no different than what many other Black people suffering in a hospital might experience in terms of racial bias. But I don't have any specific anecdotes around maternal health and sickle cell disease other than knowing your trait status, and making that decision about whether you want to marry somebody who also has the trait, because you have a 1 in 4 chance of having a child with the disease.
Yeah. So I'm glad you sort of mentioned the medical bias and what some folks experience, especially related to access to medicine. So one of the things we did this year in the General Assembly is we passed a correction for some of the prescription drug monitoring programs to ensure that patients with sickle cell were not subjected to the same wait times and treated like sort of drug addicts. Because with the law prior to us passing, people with certain conditions, extremely painful conditions, had exemptions for prescription monitoring programs, because when you deal with a chronic painful condition, there's a general understanding that you need access to very powerful medicines, sometimes for more extended periods of time. So other diseases that did not disproportionately impact Black people had exemptions in the law. And year after year, sickle cell advocates were coming to Richmond and asking to be included in that exemption as well. And this is something I've personally experienced with trying to get medication for my daughter. And oh, she had a prescription 7 days ago. Well, she's been in a crisis for 10 days. And going through those hoops. And so we passed the law that would ease the restrictions on sickle cell patients for access to prescriptions, because what I find within the community and personally, because people with sickle cell live with a painful condition, they're some of the most aware and knowledgeable people about the potential dangers of drug addiction and chemical dependency. And so this paternalistic idea that a person who's already living with a painful condition doesn't understand how that works, it was sort of disappointing. But we were able to pass the law with bipartisan support.
That's wonderful.
And so I think the next question for us is, how can individuals and organizations like Birth and Color and others support, better policy and awareness for sickle cell?
So education, like what Birth and Color is doing tonight, is important.
Oh, Cindy, I think you have unmuted yourself.
Oh, there she goes. And that can be formal and informal, right? I mean, one of the things that I do is make requests to organizations like the NAACP, or at a church, or at a high school, to educate people with a presentation. So it can be 20 minutes with 10 minutes of Q&A, or it can be an hour, right? I can put together any length of presentation to give as much detail as anybody would want that I'm capable of doing. Health and wellness committees of sororities and fraternities and churches are another place where this education can happen. And for us, the Red Cross, because we are trying to collect blood, we want the education to activate someone's will and conscience to then take that next step and donate blood. So I think that awareness and education is key. And this aligns with all of the education that we know exists within the Black community already around diabetes, around prostate cancer, around heart disease, right? I mean, there are already issues that we embrace as unique to our community. And because 90,000 of these 100,000 patients in America are Black, we owe it to our community to add sickle cell disease to our slate of educational resources and offerings.
For sure. And I think within that education, as we think about reproductive health and pregnancy, for me, I think that the educational forums that you described are so important. But I will also say, from a policy perspective, that we need to understand that people with sickle cells and other blood disorders, access to quality reproductive care as well as contraceptives is so important, in the process. People who get pregnant who have sickle cell disorders face a higher risk of complications during pregnancy. And I know many people who have beautiful, healthy babies and healthy pregnancies, but they understand that there is a risk and there are extra precautions that you have to take when you are planning a pregnancy with sickle cell. And access to good quality care and medicine is an important part of that. So I would just say for those who want to get involved, understand that reproductive health care, reproductive freedom, contraceptive access is very important to anyone living with a chronic disorder, but especially with one like sickle cell that is categorized by pain mainly. And I just wanted to, because we talked about the pain crisis, but sickle cell is almost like, so I'm involved in autism advocacy as well. And you see the puzzle, and we say autism is a puzzle, that no two pieces are the same. Sickle cell is the same way. So in addition to those pain crises and lack of oxygen that we talked about, there's also acute chest syndrome, which is a very painful sort of lung disorder for babies and young men. There is priapism, which is a very painful sickling of the penis. And with the babies, they can, for hours, just crying and in pain. And one of the things that I'll share from my personal experience is that some of the highest level of medicines don't always work for sickle cell pain. There have been instances where my daughter was hospitalized and she was getting, as much as they could give her, and she was still in pain. And it is so—
How old is she?
She just turned 14. Whew. She just turned 14. And she turned 14 and she has sickle cell SC. And so I encourage everyone to look at the different variations. So that means that her dad has an S type and I have a C, which SC is seen as a milder version of sickle cell. And I can tell you, when my baby is in a crisis, there is nothing mild about what she is going through. And even when, there are, so SS, so sickle cell disorder SS, which is known as a more severe version, you have little babies that have their swelling and painful swelling in their hands and feet and very high fever. And some people who have spleen sequestration, where there's like buildup in your spleen, which is extremely dangerous. So sickle cell disorders are really nothing to play with. And
Oh,
so
wow. I didn't know that it was so many different variations based upon the type that both parents have.
Yes, there is. And then there's also, as Ms. Mary said, 90% of those living in the US are people of African descent. There's a growing population as families integrate, and there's a growing Latino population, but there's also beta thalassemia, which is a type of sickle cell trait and disorder that is seen at a high level in East Indian populations. And so there's just so much that we have to learn. And for my family personally, I listened to the stories. I told my daughter I had the privilege of growing up with elders. And the older I get, I listen to the stories and I realize that a lot of what my family was describing was complications of sickle cell anemia. My great grandmother always had bouts of pain where there were days where she couldn't get out of the bed, and she would have the issue of pain, and she just, pushed through it, and she had children. But she died of stroke complications at about 46 years old, which is, as we would say today, that seemed pretty common for a person living with sickle cell, because prior to the last, I would say 40 or 50 years, sickle cell was known as a childhood disease where people didn't live past the age of 18.
That's right.
Wow, that's a lot. So what do you do in the instance where your child is in that much pain, and it's from the sickle cell disease?
So for me, and Richmond is so extremely blessed to have amazing sickle cell advocates and resources. Some of them are resources that I even use from Northern Virginia, because when my child was diagnosed 14 years ago, I tell people I go to the doctor more than anybody that I know. When I was about 18 years old, I had a mentor who said to me, Candy, if you want to live a long life, go to the doctor, do all the things that they say. You turn 40, get a mammogram. You turn 45, get a colon. Do all the things and you'll live a long and healthy life. So even as a young person, I went to the doctor more than anybody that I knew, and I did not know that I had sickle cell trait.
Wow.
So the community in Richmond and in Northern Virginia taught me more than any doctor when my daughter was diagnosed. Started very young with helping me understand pain management, and how to help her through. So she, learns a lot of alternative pain management. But the biggest thing that I feel that you can teach your child as a patient with sickle cell disorder is advocacy. No one knows what she is feeling. No one knows what they are feeling but them. So even when there are times where I'm like, well, they've given you all this medicine. What do you mean it's not working? She knows her body and need to listen to that advocacy voice. But we use a lot of alternative medicine for adults living with sickle cell disorder. A lot I've learned, sickle cell has turned me from just say no to understanding medical marijuana and the role that it can play in pain management. Even as much as we've done acupuncture, which seems like it wouldn't be helpful, but it actually is. Chiropractic, regular massages, aromatherapy, all of those things.
I love that you specified how you are using holistic treatments, because back in the day, like, this is what our culture was actually really using. But a lot of times they try to tell us like, oh, that's not a part of self-care. But all of those things are a part of self-care, and it's also helping to manage and prevent the pain from really truly coming. I mean, the pain is never going to go away in that sense, but it's also helping a preventative measure so it's not as bad, or that they do have comfort measures. Just like in doula care, we always talk about comfort measures. And so I'm glad that you actually offered those things as something that people can actually look into for themselves.
But that's why the blood donation is so important. Like, I cannot, not enough of us are donating blood. And it is what you just described. You can prevent the severity of the pain crisis. You can prevent how long the crisis lasts through donations, and not enough of us are doing it.
No, and honestly, I think when it comes to like the donating blood, I don't think enough education is provided to the reasons why you should donate blood. Instead, in the Black community, even in the BIPOC community, not just in the Black community, we're always like have a radar up of like, what you need my blood for? Like, what you doing? Like, because of all the history of things, right? So if people truly knew like, hey, me donating blood can actually help someone, a sickle cell survivor. Like, this is what it's actually me. This is what my blood is actually doing? It's not just so they can test it, whatever the thoughts that are running through our head or what we've been taught along the way. And I think that the way that you just laid that out, I think that should probably be a campaign all by itself, just because it was like, oh, why don't you donate blood? And it was always like, okay, if I go donate blood, like what am I doing? Like, and and that's what the community is telling me. Like when I say like, oh, you gonna donate blood? What you got gonna? Oh, those are for people who actually just need the $40 or need the. And I'm like, that's not even. They don't even give you that for donating blood. That's for plasma. And they're like, what? And I'm like, yes, that's two different things. So I think that having more of a.
You get some cookies and juice.
Well, we do give gift cards. We do give gift cards. but I appreciate you saying that. I mean, this is why. So there's about 20 of me across the country, which honestly is not enough. But they've put us in the high population areas where Black people are to do the education and to dispel some of the myths and concerns, right? Mm-hmm. Like when I do my talks, I'll talk about Henrietta Lacks, right? I'll talk about the ways in which Black people have been abused. I'll also say that sometimes a family reunion where the elders are is a bad place to get medical information because they, and I tell my colleagues this because we're discouraged by the numbers, which I'll share, but we're still living amongst people who had to sit in the back of the bus. And so if they have negative experiences, they are valid, they need to be acknowledged, they're real, and they do still happen. But at the same time, everybody needs blood. Every 2 seconds, somebody in America needs blood. Mothers giving birth need blood. Cancer patients, people having surgery, and sickle cell patients, right? By the end of the day, one of us might need blood, and we want that blood on the shelf, right? And so what happens with the sickle cell patients is the medical community has to be extra determined to find compatible blood for these patients. Otherwise, their body will produce an immune response and reject that. And over time, their body becomes more and more particular about what blood it will accept. And so there is an antigen found on 1 in 3 Black people of African descent have this CEK negative antigen on their blood that's a match for sickle cell patients. And so when somebody donates, if they self-identify as Black, multiracial, or African American, their blood's going to get screened so that it can be expedited to the sickle cell patients. Because look, 80% of blood donors are white, right? 90% of sickle cell patients are Black. Right. And so 1 in 3 Black people are matched. 1 in 250 white people are matched with that CEK negative. And so sometimes a sickle cell patient might be waiting in the hospital for a blood transfusion because the blood that they need is not there. And so this is the education that I do to dispel the myths, to talk about the need for blood, that blood is universally needed. We all need it, right? And it can't be made in a factory. It's got to come from other human beings.
Yeah, and I will also add to that, for people like me and others, it's all the more important for us to get our anemia and vitamin D and all of those things in check, because there were many years where I couldn't donate because of my anemia. And that's not because of sickle cell trait, it's because of not addressing the anemia. Right. And, so you can have life-saving power within your blood, but if you're not, addressing those underlying conditions, you won't be able to help people.
Yeah, and that is some of the educating we do around a high iron diet, especially ahead of your blood sugar.
Yeah, that's important for people to know. And that's one of the things that we talk about to our pregnant people, is by saying, like, you have to make sure that your anemia is well. Have you got it checked? What is the levels? Just because there's so many different disparities when it comes to anemia that we're seeing across the board, is like everybody needs to take some type of supplement, and just making sure that they're eating properly like they're supposed to. So what is a recommendation for new parents when they're pregnant that they should be thinking about, to either that they have a sickle cell, that they have sickle cell traits, or that they have sickle cell themselves? What should they be doing to like help their children that they are having now? Or what preventive things can they actually look into if they have a baby that is born with sickle cell?
Candy, you can answer that.
So I would say, to not be like me. So when I was pregnant with my daughter back in my day, I feel like an old lady, you had to get an amnio, right? So you had to get a needle in your belly while you're pregnant to see. And I was like, oh, I'm having a baby. Whatever she got, we'll deal with it when she gets here, right? But that is not the best path that I learned, because even if your child has, sickle cell trait, you want to educate yourself before your baby is here. If your child has a sickle cell disorder, then you want to be in the know so that you can get on the waiting list for doctors, or you can find out where the best care is so that you can be prepared to educate yourself. Because that is what is, as Ms. Mary said, that education piece is what's missing in our community. So as you're starting a family, if you are fortunate enough to plan, I wasn't that fortunate to plan a family, but if you are fortunate enough to plan, then take the extra step to find out if you have sickle cell trait, if your partner has sickle cell trait. And then through, when the time comes now, I think it's a blood test, right? So you don't have to get the needle in your belly, but and get all of that testing. Don't be afraid of the unknown. And then find a community. These are people that, for 14 years have been my what do I do here? I'm in a group on Facebook called Sickle Cell Hospital Chatter. And these are people who are either hospitalized or there to support people who are hospitalized. It is a lonely place.
Yeah.
Especially in some communities, rural communities, where you don't have hematology, you don't have a group of hematologists. You may have a hematologist that's between 5 or 6 hospitals, right? And you don't have that quality of care. At hospitals in Northern Virginia, you have a child life specialist that goes around to, help your kid play games or play an instrument or do something to take their mind off the pain. Every community isn't that fortunate. So when you are pregnant, when you are planning your family, just like we do for the best schools or other resources, be in the know and then find the best resources for your family.
Thank you so much for providing that. Is there any type of legislation that can be done as far as health systems and making sure that they have teams that are qualified for sickle cell? Similar to, they passed the law, I believe last year, about for like sexual assault victims, that now you have to transfer them. If you don't have anyone at your facility, you have to transfer them to, I believe it is St. Mary's. And it's this whole thing, it was a whole big thing in the newspaper last week about who was in compliance and who wasn't. Yeah. Is that something that is done or can be done?
So the first step, which we went into last year, so this year, our house leadership made sickle cell disease disorder one of the top priorities. So we passed, I think, 4 or 5 pieces of legislation and a good chunk of the budget to go to the Hampton Roads area, where we have our largest population of people living with sickle cell disease, but we also have our largest population of death, of premature death related sickle cell. So we have funding going there. One of the laws that will go into effect over the next 2 years, which I think is really important, is the registry. Where we struggle is we don't know where people with sickle cell live. And so Delegate Josh Cole passed a law that will create a registry where people can show us where they live so we can better put resources in those communities. Because where I live, for example, I am between Washington, D.C. and Richmond. And I'm about 35, 40 minutes from Fredericksburg, about 30, 45 minutes away from DC. Well, there's no comprehensive pediatric hematology within 30 miles of my community. So whereas Prince William County in particular has the largest number of babies born with sickle cell disorders, those babies have to go to Children's National in DC or a hospital, Inova in Fairfax, to receive care. Or they go to Fredericksburg, or many of them pack up their families and go to VCU, where Dr. Wally Smith is providing some of the best care in the country. And so what does that look like if we could clone Dr. Smith and have a Dr. Smith in every community? And so I think that is the next step for us. So we passed Terrence's law, which will require faster onboarding of new medications. We passed the registry. We have passed the bill to require that doctors offer trait testing. And then we've passed the bill to take away some of the restrictions on access to medicine. But the next steps, I think, are replicating the amazing work that's being done at VCU. And then on the education piece, the NCAA does a pretty great job of education and training for student athletes on the collegiate level and testing as well. But our high schools, middle schools, recreational sports do not know enough about the hydration needed, the rest needed, and the things that you can do to prevent those sudden deaths that we've seen across people. So we think the next step is figuring out how to educate the educational system about sickle cell trait.
Thank you so much for that, because we did have one death in Virginia at a school here because of this issue. And so one of the things that we were all like just trying to figure out what is a better way to educate the community.
Now, are you referencing the Virginia Union death?
No.
So there have been multiple. There have
Okay.
been multiple deaths. So a young man died on the football field at Virginia Union about 2 summers ago from sickle cell trait. There have been over the last 10 years, there have been quite a few throughout Virginia.
Oh, wow. This was just a high school, 15-year-old high school boy, football practice. And it was the AC had went out at the school, and then they still end up going to practice. And so it was dehydration and like all of the other things. And so one of the complaints of the coaches were like, we didn't even know anything about that he even had this condition. He didn't know that he had it. And so it goes back to, how can we figure out a grassroots level of education also? Because we do know that not everyone is going to tune into certain things to listen to or be educated or even think about like, okay, they're actually telling us the truth, and just trying to figure out how to go back to the basics.
The same thing they've done with concussions, they can do with sickle cell. Your child doesn't even get to try out or set foot on the field without you and that child doing some concussion training. So I think we can figure out and I know this because I have a child waiting for me right now for me to do his concussion training. but we can make that effort for sickle cell as well.
And that is very true because my son, I did have to do concussion training for him. And so that could be something that, you know, we could get the schools on board with to say like, hey, you know, this testing is required. This is required in order for them to even play any type of sports. Even when it goes to a step further of like when they get those yearly physicals, like how can that be a check off the box to stop it there? Because, you know, at certain ages you're required to have physicals, so why isn't that one of the things that they do already?
Yeah, I think that's important. And one of the things the Red Cross is doing as part of the Sickle Cell Initiative is trait testing. So when you give blood and identify as Black, your blood's going to be tested for the sickle cell trait, and that'll get confirmed. And a lot of our most successful blood drives are in high schools and colleges. So, you know, trying to get that education to those students is so important. And, you know, the other thing I would just want to help us remember with our children and them understanding and knowing their trait status is that having a child with sickle cell disease, as Candy can attest, is not just the pain that they're going through. Like that is enough by itself. But there are other quality of life challenges. You know, if a child's in the hospital, they're missing school. That means mom might be missing work. Means they might be losing income, right? And so the mental health stress of all of that is not something that any of us would want to endure if we don't have to. So just being able to tell the young people the importance of this, because they have to do the cost benefit analysis in how they choose to proceed with their romantic life and their childbearing years.
Wow, thank you for that. Because we didn't even get to talk about the disparities of it all and the things that parents do go through and that the children go through when, you know, living with sickle cell. How do you really be deemed a survivor of sickle cell and all of the things that come along with that? How do you actively make sure that you are living a stress-free life? And so what do you guys recommend in our final words of like, hey, you know, if you're living with sickle cell, drop some resources, talk about what they can actually do. And is there anything for parents that are struggling financially and having to, you know, with the hospitalizations and things like that? Is there any type of resources for that?
Yeah, there are quite a few foundations throughout Virginia who provide support to families. I would say to definitely check out the Sickle Cell Disease Association of America, the Heart of Gold Foundation, it is escaping me right at this moment, but there's a phenomenal foundation doing work in the Richmond area. VCU is a great resource, because one of the things that I think has been really important to us is getting the school support and care so that your child patients with sickle cell qualify for 504 plans, which are sort of like individual education plans that you can set up for your child so that, you know, they can keep extra water or keep a jacket in the classroom so that they're not outside for a gym when it's 30 degrees outside. You can put these ramifications in place to get your child the support they need, even if that support is homebound care during a crisis or an extended period. But to me, the community in Virginia has one of the largest sickle cell communities, I think, in the country. But finding your tribe, so to speak, I think is really important for anyone, and it has been a lifesaver for me. So some people may know that I'm also a different child, but I'm also the parent of a child with a disability. And sickle cell and autism, for parents, the struggles are so similar because you get all revved up and you're like, I'm going to do this, I'm going to do that, I'm going to do that, I'll do this. And then you get tired because you are fighting against a whole system that is not designed to be easy. It is not designed to get you the resources that you need. So you have to take a break. You have to rely on your community. You have to focus on your own health and wellness so that you can be fit for the fight ahead and to support your loved one as needed. But you have to take care of yourself and use the resources within your community. And I find social media to be one of the greatest resources for quality community. And I think, as Ms. Mary said, that the elders are not always the best resource for health information. I would give that warning to online communities too. It is not the space for health information, but it is the space to find community, to find support, to find other kids who or young people who might inspire your children, and those who are able to, go to the conferences and engage in those things. I definitely say do that as well.
Thank you so much for that. That is very important. I love how you talked about, yes, use social media as a community, not as health information. Take from it what you need to take from it, and the rest let it go, because not everything on there is correct. And so thank you both for this amazing conversation. Definitely feel like it could be a part 2. Does anyone have any questions at all for either of the guests?
Good evening. I have a question. I'm Terry Page. I am one of the providers at Virginia Women's Center. And I just want to say that we do screen all our African-American women or women of color for sickle cell trait. And if they do possess that trait, we definitely will bring the father, the baby in, generate a chart for him, and also have him screened. Wonderful. So I just wanted to share that information. But, just as far as from an education.
Thank you. Thank you so much, because your colleagues were giving me HE double hockey sticks about me trying to tell them how to do their jobs.
Wow.
I just don't need me to tell them how to do their jobs.
Wow. That's good to hear. That's good to hear, because, as a provider of color, and one of the only provider of color at this practice, I feel like I have to advocate for a lot of patients here at the practice. But another question that I have, and through working with organizations, churches, and sororities and fraternities, there is a resistance out there in the community. We have tried to host several blood donor programs, either at churches or at libraries. And the turnout is so low. It's so low that, what can we do, as people in the community, like you stress, to get the campaign out there, that we need African Americans to donate more blood, not just in January during Blood Donation Month, but every month. And I've contacted, not you, Mary, but I have a contact, I can't call her name, but through the Red Cross. And we have hosted, sorority has hosted several blood drives at Verona Library.
Okay.
And we've had volunteers come out, to help with setup, but from the sign-in sheet, only maybe about 5 or 6 people have shown up.
Yeah, so thank you for that question, and thank you for your efforts. I think that this, where the rubber hits the road, is how hard it is to recruit Black people to donate blood. And a successful blood drive for the Red Cross is a drive that collects 20 units or more. Okay, but to get 20 units, you've got to sign up 50 people. Because 10 of them won't show up, 5 of them will be sick, 10 will get deferred because their hemoglobin's too low.
Right.
And then that's how you get to 20.
That's right.
And so, starting well in advance, partnering with multiple organizations so that the network is bigger will help you with more success. And then bringing me in to do the education also. But just for context, only 3% of the eligible population donates blood. So broadly speaking, it's hard to get the whole world to donate blood. Right. So you're not alone in that, but the education is part of the motivation hearing that this is something the Black community can do for ourselves, for each other, is a big, big piece of the puzzle.
And one of the things that I always recommend when talking about screenings, drives, definitely partnering with multiple organizations, but also, you know, when you're thinking about hosting a drive, I think education piece before you even start to promote the drive, right? Because some of our people, because of the history of everything that they've been done to us, they're sitting at home like, I'm not giving them my blood. But even just hearing Delegate King talk about, this is the reason why we need the blood, like educating our people, like, we need your blood for these reasons, because they don't know. They're only seeing a promotion like, oh, a blood drive. So it's just like, oh, you just want my blood. You just want to test it for something. I might smoke weed here and there. So is my blood good enough? These are things that, you know, we have to be able to meet people where they are and then give them the information to say, this is what we need. Meet us here at this such and such time to please help us. Yeah, and like that little one campaign can just triple the numbers, because you're actually telling them why they need the blood, not just the flyer that says, hey, it's a blood drive. Why do you need my blood is what everyone, when I say, like, do you know their blood? They say, why do they need my blood for? And I have to re-educate, like, you know, these are all the things I say. If they hemorrhage right now, I say, even when you talk about maternal mortality, I can't talk about maternal mortality if I'm not talking about the blood donations and blood transfusions and all of the things that come along with it. And they're like, oh, we didn't even know that. I'm like, yes, when someone needs blood, where do you think they get it from? Right. And they're like, oh, we thought that they just, and so it might sound so simple to us, but some people truly think that the hospitals have unlimited amounts of blood that they don't have.
That's right.
And to add to that, the other piece also, like you all touched upon so eloquently, is the anemia piece. There are a lot of women of color out there who are so anemic. I can't tell you how many women I have referred to iron infusion therapy. I mean, I mean, these women are, I mean, that brings on other issues like uterine fibroids or uterine polyps for women of color. But I mean, our women are out here walking around with hemoglobin, the blood clot levels 9, single digits. They're not even double digits. So then they won't even qualify to donate blood. Is it 12.5 and hemoglobin has to be in order to donate blood?
Yes.
Yes. And so every time I educate Black women, I always have to think about it from the point of view that when we grew up, right, our ages, like people who are my age and younger, I mean older, we were told not to go to them doctors for everything. Not they're just gonna harm you, they're gonna do this, they're gonna do that. So we still have to think about that part of the community that is like, well, I have these things going on, but I'm not going to the doctor. I don't know how to properly eat because I've never had someone tell me how to properly eat other than in elementary school. I don't know what things I should be giving myself, let alone my children. And so when we talk about all of this in context, it's like, Dang, what can we actually do to say like, hey, Black women, come meet us here and let's talk about all of these things just in general, regular conversations. I was just talking to my team about, we used to do like community conversations and panel discussions, and we just like, it wasn't anything formal. And just everyone talking about what issues they had going on. And we were able to do a lot of just great work in getting people to go to the doctor and dispelling certain things just by having those community conversations, and maybe a cookout style, maybe something, but we have to all like really unite and come together and think of ways that we can actually educate the community to say like, hey, you know, this is what we actually truly need to be doing.
Yeah, and I think we have to tell our stories as well.
Yes.
I'm so surprised when people, obviously it's personal for me, but I'm so surprised when people don't know about those young men who died playing football, who had sickle cell trait, or some of, you know, the information that is out there. We have to tell our stories, share our stories. And yes, we have success with the CRISPR technology, which is a new emerging technology that can cure sickle cell, but it's extremely risky. It's extremely expensive. It is rare for people to get access to it. Most folks are managing their care and minimizing the damage to their organs through blood donations.
Mm-hmm.
And I think we had
I definitely agree with you on that.
I think Ms. Mary answered it about screening for trait. Yes.
Yes, if you have the feasibility to screen all of the patients, screen all of them, because they all need to know whether they have it or whether they don't, and then also need to be screened for anemia and other things as well, because it could stop there and say like, okay, here's the education on how you cannot be anemic anymore, and here's the cons that if you don't fix your diet, that could potentially happen to you.
And I wanted to add to Terry, I have found success with college students. I found college students will give that blood away if you put out a tray of sandwiches and cookies. And there is something else going on sort of in the whatever the common area is, we have them. They come through.
Well, does the Red Cross still go to the churches? Because I know I'm a member of St. Paul's Baptist Church. We would have blood drives all the time. I know COVID hit, and I know COVID changed a lot for dynamics as far as staffing, but is the Red Cross still going into the different churches?
Absolutely. Girl, I've been trying to get to St. Paul's for a long time. Put your information in the chat, because you can help me run a blood drive at St. Paul's.
I sure
It's
can.
one of the biggest Black churches in Richmond. Yes, yes, yes.
Yes, definitely St. Paul's. We do a lot of maternal health education over there as well. Definitely a great community partner, and always making sure that their congregation knows about everything health related. They have multiple health expositions throughout the entire year. And they have food, like real food, y'all. But thank you all so much for your time. We truly appreciate it. Drop your information in the chat if you want people to be able to reach out to you. And then you can always find Birth in Color on all social media platforms, Birth in Color.